physical therapy tests for ankle sprain. Ankle injuries are very common. 1 out of 3 clients I work with reports having an ankle sprain in their lifetime. When I'm working with anyone with an history of ankle pain or ankle sprains, I'm working on getting them back to their previous activity level. Whether you're a high school football all-star or a marathon runner, returning to full functional is mandatory. Unfortunately, ankle sprains have a high re-injury rate. Functional tests are designed to simulate the activities performed by the person, truly testing if they are ready to return to full participation. However, depending on your goals, the functional test for one person may be completely different from another. Nonetheless, here are 4 functional tests we use for ankle sprains. 4 functional tests for ankle sprains. 1. Dorsiflexion lunge test. Dorsiflexion is when you bring your toes closer to your shins, when your heel lands first when walking. This test is a weight-bearing test that tests if you have a decrease in dorsiflexion. How to do it? Put your foot near a wall about an inch away. Put the other foot a foot away from the front foot. Bend your front knee until it touches the wall. Make sure your heel is still on the floor. Inch forward if you can't touch the wall. Change feet and repeat the test. How do you know if they pass this test? Compare to the other side. If they are lacking, what can they do to help improve these results? 2. Star excursion balance test. This test is designed to increase strength, flexibility and proprioception in your ankle. This can be a challenging exercise because if you have instability in the ankle, it can be very difficult to accomplish. Research have suggested to use the star excursion balance test can be beneficial to ensure dynamic functional symmetry. How to do it? Put 4 pieces of 6 to 8 feet long athletic tape in an X pattern on the floor. Stand on one foot in the middle of the C pattern. Find your balance. Touch all the spots with the foot that's off the floor. Repeat on the other foot. How do you know if they pass this test? Compare to the other side. If they are lacking, what can they do to help improve these results? 3. T-test. As athletes, we need to be to change directions on a dime. It is an essential component of team and field sports for a variety of reasons. Neuromuscular control, injury reduction, and overall performance capabilities. The T-test strengthens your forward, lateral, and backward movements. How to do it? You'll need 4 cones. Place cone 1 at the start. Place cone 2 10 yards in front of cone 1. Place cone 3 5 yards to the right of cone 2. Place cone 4 5 yards to the left of cone 2. Start at cone 1. Sprint to cone 2. Shuffle from cone 2 to cone 3. Shuffle from cone 3 to cone 4. Shuffle from cone 4 to cone 2. Backpedal from cone 2 to cone 1. How do you know if they pass this test? Compare to the other side. If they are lacking, what can they do to help improve these results? 4. Standing vertical jump. This test is a power test that involves strength and flexibility in the ankles. When we have imbalances in muscle strength, this may lead to an increased risk of injury. How to do it? Stand with your feet shoulder width apart. Keep your knees bent in an athletic position. Hands to your sides. Squat down to a quarter squat. Explode up through your toes. Drive your arms up as you are exploding up. Reach as high as you can. Land back to an athletic position. Do not lock your knees. How do you know if they pass this test? Compare to the other side. If they are lacking, what can they do to help improve these results? Summary of 4 functional tests for ankle sprains. As strength and conditioning coaches, our main objective is to do no harm. When we are working with athletes that are coming off injuries, we need to not only strengthen the area that is hurt, but everything surrounding the injured area. We want to eliminate any setbacks. If that means holding the athlete out for a little bit longer, this can help them stay safe in the long run. These are only 4 tests, many others exist. Also, the actual sport is another test, likely the most aggressive and specific for the athlete. This makes knowing the sport and being open-minded to going to a practice helpful for the athletes. For you athletes, be smart, you know your body. Protect your body. If it's not a 100%, tell someone so these injuries won't prolong. Physical therapy and sports injuries. Sports injuries are common, whether you are a professional athlete or someone who enjoys recreational games of basketball or softball. Injuries can occur as a result of almost any kind of competitive athletics. While some sports have greater risk for injuries than others, any type of physical activity can cause injuries, such as pulling a hamstring while jogging or spraining an ankle while playing beach volleyball. Recovering from a sports-related injury often involves physical therapy, and the education that takes place during rehabilitation can help athletes identify specific injuries, how to recover from the injury, and more importantly, how to avoid further injuries in the future. A sports-related injury can be from physical contact with an opponent or from any number of twists and turns you take while running or falling to the ground. The most common sports injuries include sprains, strains, knee injuries, and shin splints. If an injury is severe enough, it may require surgery, but if there are no broken bone or ligament damage, many sports injuries can be treated through physical therapy. Most therapy programs designed for athletes involve rehabilitation and rest. Rehabilitation is used to return strength and flexibility to an injured body part, while rest is always recommended so an injury can properly heal. The initial treatment of a physical therapy program will be moderate, since aggressive movement of an injured body part can lead to further damage. When starting therapy to rehabilitate a sports injury, be prepared to take it slow. Athletes often have trouble with this discipline since many are trained to be fast and explosive, and not many can deal with the mental strain that comes with nursing an injury. Many athletes suffer psychologically when injured, since most develop a sense of immortality due to their physical prowess and being forced to the sideline because of a sprain or ligament strain is a difficult situation to accept. The worst thing an athlete can do is play through the pain and try to ignore it. The longer you exercise or compete with an injury, the worse it will get.